1 second.
Here we go. Good morning, everyone. This is Kathy Bush, and welcome to the DandleLION Medical Webinar on The Experience is Everything. We're really pleased to have Lori Gunther as our faculty presenter today. Lori is the Director of Strategy and Experience, NICU Innovation, at the National Office of the March of Dimes, and she's also the President of Virtual Leadership Solutions, LLC. Lori has her bachelor's in psychology and her master's in community counseling. She has previously worked in the fields of victim services and is a nationally recognized expert in the fields of quality improvement, crisis intervention, PTSD, communication skills, and she's also a certified patient experience professional. She's been a national trainer for over 20 years and oversees the quality assurance and expansion of NICU innovation for the March of Dimes. Lori, we're really pleased to have you this morning, and we can't wait to hear your information.
So Lori, just go ahead and press *6.
Okay, great. Can you hear me, Kathy?
Yep, you're good to go.
Okay, great. Well, thank you so much. Good morning, everybody. This is such a great opportunity that I've been afforded. So thank you, Kathy, and to DandleLION for hosting this great educational opportunity. As Kathy mentioned, my name is Lori Gabriel Gunther, and I'm the Director of NICU Innovation. And I'm very excited to be presenting this webinar today on The Experience is Everything. I just wanted to make sure that I went ahead and did our learning objectives for this webinar. We have 3 different learning objectives. 1, to identify 3 areas of priority for patient experience. 2, to discuss the purpose and process for utilizing storytelling for quality improvement initiatives. And then 3, to discuss 2 strategies to support improved communication between families and staff. Okay. So I want you to just take a look at this picture. And when I look at this picture and I see this, it creates a lot of different emotions and feelings for me. 1, as a patient or a family member of a patient, and 2, as a staff. But let's focus for a moment if you were to see this and walk into this as a patient or a family member, what kind of feelings would this bring up for you? Dark and white, scary. You could be walking down this hallway thinking, I have no idea what I'm about to encounter. I have no idea what it'll be like when I leave this institution. I don't know what's behind those doors. It can be scary just stepping in to the healthcare environment as a patient or a family member. And I think unlike other industries, healthcare is unique because everyone is involved. Everyone is a patient. And this informs what leaders in the industry aspire to do every day, which is to provide safe, high-quality care with the best outcomes in the most cost-effective way. When you think about this in a professional way, as a healthcare provider or administrator, many things must be considered. So let me ask you a quick question that I'd like you to type into the chat room. Let me ask you, what is the most important aspect of patient care to you in your role? And Kathy, if you can let me know what people are typing in.
Okay, over in the chat, communication. Communication, support to families and babies, communication, dignity, customer service, patient and family-centered care, pain management, patient satisfaction, making families feel comfortable caring for their infants, patient family-centered care, trust, helping parents feel welcome in the NICU, helping them transition from passive parent to empowered parent who advocate, partnering with parents, establishing a relationship. These are great.
That is great. Well, you all are in the right place. This is the perfect webinar for you. And that's great. You know, I always think we want our patients to feel cared for with respect and dignity. We want them to feel safe and that they got the best care possible, right? So let me flip that for a minute and ask you, what don't you want your patients and families to be thinking or telling others when they leave your facility? What's scary? It's always easier to come up with the more positive than it is with the things that you worry about. What don't you want your families leaving thinking?
That we don't care, that the hospital is just a bunch of idiots, incompetence. It was a horrible experience. They have suboptimal care. Staff was unsupportive. They have a fear of leaving their child. We don't care. Horrible pain and no one cared. Staff was unsupportive. Everyone giving me a different message. They have a bad experience. Language barriers, not addressing cultural issues. They felt like they could have gotten better care somewhere else. I don't know what they said. You don't want blank for your nurse. You have to watch them all the time. They don't understand me and my family. Staff was disorganized, lack of empathy, afraid to leave baby.
Okay, all right. Well, that is a lot, and that is scary. We don't want that feeling. We don't want parents to leave thinking that their baby is unsafe. We want them to feel as though they were communicated with. And I just want to say that one of the things that I've learned in all of my years of doing work around communication and education, but also I have toured over 46 different NICUs in my time here with the March of Dimes, and I come in as an observer, you know, and even the facilities where they have so much to offer and are doing such a good job with patient and family-centered care and patient experience as sort of forefront in their strategic thinking and planning. I always think that as leaders, we need to know and come into every day of our work and think that things can be done differently and things can always be done better. That evolution is just part of our thinking and our process that enables us to create change and not fear change. So I'm just going to say that again, that if we think going into every day that we can always learn to do something better and differently, it enables a different kind of thinking, right? That evolution is part of what we do, and it's always evolving in healthcare. So I absolutely love this image. It's a bit of an older image. I took it a few years ago. I actually took the picture, and I'm curious, what do you think that this person is thinking? What do you think they are feeling right in this moment? What did we capture here? Kathy, if you can let me know if they're writing anything into the chat box, that would be great.
Sure. Compassion, helplessness, overwhelmed, wish I could touch and hold my baby. Helpless, looking into a different world. So far away, scared of the unknown, fear, scared of the unknown.
Great. Okay.
Did I cause this?
So, did I cause this? That's great. Okay. So, and I think everyone's perception of a situation is different. And we've all walked into rooms and we've seen parents looking at their baby and we can imagine what they're thinking. And, you know, we come in with our own perceptions. When I tell you that this actually isn't a mother, and this was the physician that delivered this baby, changes it, right? Maybe what this physician is thinking, feeling. So when I asked her, I said, tell me, what were you thinking at that moment in time? I was floored by her response. She said, you know, Lori, as a provider, as an obstetrician, it is so hard to go back into the NICU. And I said, really, why? You know, I hadn't really occurred to me. And she said, because the NICU is where I've failed as a provider. And I stopped and I thought about that. And I said, tell me more. And she said, you know, I never want my patients to end up in the NICU. And so when I walk in there, I'm surrounded by thinking, what could I have done differently? What could I have done better? And she said, this is where we don't want our patients to end up. So walking into the NICU is like walking into a room where I'm surrounded by my failures. And I have to say that never would have occurred to me. And when I worked in a NICU, you know, we very rarely had our obstetricians who came up and, you know, came into the NICU. We had some, but not always. And it never occurred to me what they were thinking or feeling or what their perceptions were. And that's an important point, is that not only should we be getting information and feedback from our families and from our patients, but we should also be asking all of our employees. We should be engaging at every level. What are they thinking? What are they feeling? What do they think could be done differently? How can we support them? Asking everybody will help us as we spearhead change and leading efforts for improved patient experience, and at the same time improving employee engagement. People want to feel heard. So I'm going to ask Kathy if you mind sharing this video as we talk a little bit more about patient experience.
Patient experience begins when we have our very first contact with the patient.
The sum total of every touch point, every episode of care throughout an overall continuum.
Everything from the first phone call or first visit to the website,
a seamless transition from primary care to specialist,
to the last interaction a patient has with your organization.
We can't make an impact on why they're there. We can impact on how we make them feel while they're with us.
There is a compact that exists between the patient and everybody that they come in contact with.
We want them to feel comforted. We want them to feel like they're at home.
Staff should be knowledgeable with what they're doing and compassionate about what you're going through.
Emotionally connect with them so that they really feel that we genuinely care.
It's all those interactions from the unique healthcare systems culture.
It's everything the patient sees, hears, smells, touches.
It's the stories that people tell.
And that's a far cry from more traditional missions or visions that focus more on the business objectives.
It's the clinical outcomes, it's how they feel, it's all of that together.
A one-on-one friendly interaction between providers of service every step of the way.
People don't remember what we say or do, they remember how we make them feel.
Every part of that patient experience has to be a wow.
Okay. So Kathy, just checking, make sure you can see the defining the patient experience on your screen now.
Absolutely.
Yes.
I hear you great.
Okay, great. So I'm sorry if you couldn't actually see the people talking, but if you could hear the audio of that, I absolutely love that video. And the Barrell Institute is an amazing global community of over 55,000 members, and they really have taught me so much in my journey of understanding patient experience and how it applies to my work with in perinatal and neonatal world. So what I loved and what I took away from that video is this one woman said, you know, people don't remember what we say or do. They remember how we make them feel. And I love that. I think it's true. People see us and think about a moment within their healthcare, good, bad, the ugly. They see us in moments. And so one of the things that as I was going through sort of my own strategic planning and quality improvement within the program that I direct, it's really important to define patient experience as it relates to your work. It's important to have an overarching hospital or system-wide goal, but it's also important to have a unit-based goal. And so without a target or purpose, you have little basis for doing and why we're doing it. And for patient experience, this is illustrated in how an organization defines experience. What does it mean for you in your world? And it's a really important exercise to go through. And if you haven't, I encourage you to do that. The Barrell Institute defines patient experience as the sum of all interactions shaped by an organization's culture that influence patients' perceptions across the continuum of care. And if I go back to that very first image I showed you of that long hallway, it starts from the moment they step out of their car, from getting their parking ticket or handing their keys over to the valet, to who they see when they enter a room, to the moment they're discharged, to the way that they're getting diagnosis information. It's across the board, and it is shaped by our culture as an organization. And so I look at that, and I take also from the Institute for Patient and Family-Centered Care, their definition that patient family-centered care is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships. And that's why when I talk about this, I always talk about healthcare providers and their patients and families, that we work together in a way that will benefit both the staff and the families we care for at every step of the way, the sum of all interactions. So when I read this and I came back to my team, one of the things that I said was, listen, we have a strategic plan through to 2019. Is it time that we relook at our strategic goal, that we make it different, that we think about how we are impacting the patient experience through the work that we are doing? And it was a great process. We asked everybody. We asked families. We asked our frontline staff. We asked our national team of leaders. And we went all the way up to our president and said, we want feedback at every level to redefine our strategic goal around patient experience. And I just wanted to share what we came up with, because I think it's important and a good illustration that if you choose to do this and you're committing to looking at patient experience as it relates to your institution, that creating a strategic framework and vision is an important part of that. And so ours is that NICU Innovation seeks to improve the long-term health outcomes of NICU grads by focusing on improving the family's NICU experience. It's a large strategic vision, and we recognize that because we want to have such a large impact. But when we just stopped there, we said, but how are we going to do it? What will our strategic plan focus on? What actually do we want to measure and show impact? And so we looked at that around communication, collaboration, and partnership, and how important those three areas will be our targets of how we choose to improve the family's experience. And so if you haven't done so, I encourage you to do that. And I loved your comments in the first section about what do we want our patients to walk away thinking. We want them to be thinking as though they're cared for, that they're heard, that they're treated with respect and dignity, that it was as if they were being cared for by family members, right? And that's what patient and family-centered care experience is about to me. It's a philosophy and approach to healthcare relationships, that everybody deserves respect and dignity, that when healthcare practitioners listen to and honor patient and family choices, the experience will be better, that information is key, and that how we are sharing and communicating that information in a complete and unbiased way helps families be heard. And then I love the idea of collaboration, which is something that we placed into our strategic vision, that collaboration is important and sometimes very difficult to do, but it is central and key to having a patient and family-centered experience when our families are in our care. So there's a lot of top priorities in addressing patient experience. There's a lot of reasons. And I spent the last 2 to 3 years really taking my own time. I'm a certified patient experience professional by the Patient Experience Institute. And for me, it was a 2 to 3 year process of really taking time to educate and re-educate myself in terms of what are the top priorities in this industry that will help influence and change the patient experience in a positive way. And one of the first things that I learned was that right now, this is the #1 priority of hospital CEOs. The #1 priority. And so that is so important. And there's so many different areas that we could look at it, whether it be through service excellence, patient satisfaction, physician engagement, quality, metrics, training. And I kind of love this slide because there's so much of it and you want to say, well, which one should I focus on first? And I think in terms of as you're developing your leadership structure, in terms of how you're going to tackle all of these different areas of addressing patient experience, that we look at a couple of different ones, but that employee engagement and the patient and family voice is central in each of these. I absolutely love this quote from Lynn. She's a Chief Experience Officer at Sharp Healthcare. And she says, it's truly our culture. It's not any one thing we do, it's everything we do. It's what we do, it's how we do, it's why we do it. Because our employees, our physicians, and our patients want and deserve to have the experience that we profess to provide. And I always think, I was watching last night and a commercial came on for our local healthcare hospital right in my area. I live in Atlanta, Georgia. And I was thinking, that sounds great. And I would hope that when I go there, that that's exactly the type of experience that I get. And who wouldn't want to go to Sharp Healthcare and get this type of experience and have leadership that is professing to do this at every level, right? So the Barrell Institute is a great resource. I encourage you to go to their website. They have a lot of free resources. One of the free resources that they just published and just released the results from their 2017 benchmarking survey on patient experience. You can download it for free. I encourage you to do it, where they surveyed 944 U.S. hospitals and 246 non-U.S. hospitals. And this has been, their benchmarking has been going on for, I believe, 5 to 6 years. But I love to see the trends of how the focus on patient experience and the process around making improvement efforts is going up and up. So one of the questions that I love that they ask is, what's your current stage of patient experience efforts? And some are just beginning. And if you are in that just beginning route, that's okay. At least you have started the conversation. At least you're starting to build the infrastructure. Over here, we have 56% that are making some progress. And as we are making that progress, it is important that we share transparency. If there is one thing I have learned in healthcare, is that we need to be transparent. One, about where we're not doing things the best and we need some support. And two, about what we're doing well and how we've done it. Quality improvement is such a challenge because it takes resources, coordination, creative, and leadership. And so making that progress and then sharing openly and transparency with other institutions is important for us all making global progress in terms of patient experience. And then 26% have stated that they have a well-established focus on patient experience. So in terms of the three areas, when I look at patient experience and when we break it down in terms of our work at these three big bucketed areas, we look at patient satisfaction, patient safety, and clinical excellence. And one of the other pieces that the report sort of shared is because we want to know what other institutions are focusing on, what are their points of focus? Well, 89% said that it's around patient and family engagement. 89%. 89 said it was about service. 87 for quality. 85 around safety, and 79 around employee engagement. And then when we look at this graph on the right, I love it because it's an expanded perspective on patient experience, right? So experience is our continuum, right? So it surrounds everything, but that we want the focus to be on quality, safety, cost, service, and outcomes. We want people to think as though they were safe, that they got the best quality care, with the best possible outcome, and that they felt cared for with dignity and respect, and their needs were met. And I think centrally at that is our patient engagement and our employee engagement. And I love that employee engagement is part of everything that we're talking about now with patient experience, because if our employees are engaged and they are part of the champion movement towards patient experience, we will be more successful. The data is very, very clear on that. and that it has to be at every level, leadership all the way down to frontline. And so this was a great sort of retrospective look on the evolving focus on leadership and structure, and I just thought important to share here as people are sort of building their own structure of how this works. Who in your hospital has the primary responsibility for addressing patient experience? And you can see the red, the purple bar is from 2013 when they started their benchmarking to 2017. And you can see that the hospitals are allocating resources to the CXO, Chief Experience Officer, and Chief Experience Department. So that at the top line, at the C-suite, we have leadership that is leading some of this efforts, providing resources and support. And that we also, you can see here, that we're building these patient experience committees. And these committees really should have an important focus of providing feedback and stories from our patients, from our families, and from our employees. And so how important is the patient experience in your healthcare? I love this because an overwhelming 90% of respondents said it was extremely important, and 10% said somewhat. So it's important that not only are we talking about this as a part of service excellence, but that is essential to all themes of what we are doing. And so many of you at the beginning said that you want engaging patient and families is so important. And I thought this was an interesting, just as we're talking about sort of utilizing that patient and family voice to include in this webinar, which is, does your hospital engage patient family advisors, which would be a staffed position to really engage patient families? And we're trending behind the non-U.S. hospitals. So 67% have paid family and patient engaged advisors. And then you can see it's almost at 80% in non-U.S. hospitals. And then over here on the right, it says, does your hospital engage a patient family council, which councils are so important. And I think the makeup of councils are important. I think that diversity and how we engage people in a council is important. I think with the new ability to use digital technology and engaging people so that we don't always have the same families or the same voices or the same stories on our councils are important. And so as you're building these patient family advisor positions or patient family councils, know that the trend is that we should be building these into the very fabric of the work that we're doing. I'm sharing this slide because I love it actually. I was at a hospital. I went to the bathroom and I saw the 7 ways to improve patient satisfaction was posted in the bathroom stall. So of course I read it and I was sitting there and looking and applying it to the work that I do every day. And it can be simple. Some of the acts of what we're asking to be done don't have to be huge quality improvement initiatives. It is so much as just smiling, remembering that as we are walking through the hallways to smile. That we're looking at new ways to reach family members, and going digital is such an important prospect of gathering information. I had one neonatologist, I was talking to him last week, and he said, you know, Lori, the surveys that we get back in terms of information from families, they're either, his perception was that they either were families who were incredibly satisfied or families who are incredibly angry and dissatisfied. And he said, I want to know more. I want to hear more. I want to make it easier for us to get feedback. And I think digital technology and a commitment to really understanding how we can utilize that to get feedback from our patients and families is so critical. You certainly will have this with the slide set as we're going here, but this is a very simple way to engage and promote different initiatives that you're trying to do and talking to your staff in terms of communication. So I'm going to transition us for a minute and talk about who are we listening to? So who are we getting feedback from? You know, and I'm sorry the picture on the left is a little pixelated, but that's Jimmy Kimmel. And when he did this national plea where he talked about his son who was out in Los Angeles and being cared for in the NICU, the entire world was listening. He had the platform to be able to talk about the impact of the care that he was receiving and the importance of that care be delivered to everybody. And, you know, I downloaded it and I watched it, and the next day at work we were all talking about it and trying to apply it to what we do. And I said, you know, not everybody has that platform. Are we listening to everybody's stories? And I was having a conversation with one of my friends who's a doctor, and I said to her, you know, do you often in your day get the chance to sit and process with patients? And she said, you know, today I did. And this is a picture of her on the right. And she said, we had a very difficult delivery yesterday. And she said, I woke up this morning thinking I felt like that mom might need an opportunity to really share her part of the experience. She grabbed the anesthesiologist that was with her that night, and they went in and spent 15 minutes talking with this mom, talking about her perspective, what they had done, and if she had any questions. And the mom told her later, sent her flowers and said, thank you for giving me the opportunity to process with you because you were the one who was in it with me. And I love that. Listening means paying not only attention to the story, but how it's told. It means the use of language and voice, allowing another person to just know that you care and how important that is. And I think I love this from Stephen Covey, that the single most important principle in the field of interpersonal relationships is seek first to understand and then to be understood. Many people listen not with the intent to understand, but with the intent to reply. And isn't that so true? And so as a therapist, as somebody who worked in the crisis intervention field, I just love, and I love to do this in this particular slide, that there are 4 rules of active listening. And we could be listening all day, every day to everybody, couldn't we? I feel like a lot of what I do is putting out fires on an everyday basis. But taking that time and giving that full attention and really listening with the act to understand what that person is telling you is so key. To be non-judgmental and to give your undivided attention to the speaker. And then fourth, I'd like to just say, use silence effectively. Telling a story as a patient or a family is so difficult, especially if you're giving feedback that is challenging. And so you might take a minute and pause and just listen to what that person has to say. So I'm going to take a breath and say, I was giving a presentation about 6 months ago, and it was a very big forum, and I was talking about communication. And it was in a patient experience conference, and I had about 200 to 300 people in the room. And I shared a story that my dad had recently been ill, and it was about 2 years ago. And that I had in this one institution in a 2-week period, both the best and the worst healthcare experience. And I shared a little bit about that. I shared that, you know, the best part of our experience was that that as my dad was dying, it was right before he died, this wonderful woman came in. We were on the hospice unit, and he died very, very quickly, got sick and passed away within 2 weeks. And she came in and she put music on, and she said to me, Lori, I'm here to give your father a massage. And what I want to tell you is I'm going to dim the lights, and I'm just going to try and make him comfortable, manage his pain. And what I'd like you to do is either take some time for yourself now or put your head down and just relax. And I put my head down and I listened to the music, and my dad put his hand on my head, and it was such a lovely and tender moment for me before he had passed away. And that moment stays with me as a gift because he died Wednesday, February 18th at 2:40 in the morning. And that's when my whole world changed. And that was my very last interaction with him, and this wonderful opportunity, this program that I had been provided through the hospice was amazing. Now, if you notice, he passed away over February 18th, which is a holiday. And 2 days earlier, we had an experience where I was looking for pain medication for him. He was in a lot of pain. And the nurse came in and she said, I'll get to it. And I said, yes, but he's really in pain. Is there anything you can do? And she looked at me and she goes, it's really hard to be sick over a holiday weekend. She's like, we're just completely understaffed. And I was horrified. And so here I had these two very different experiences, different units, within 48 hours of each other. One where I felt, oh my God, do we need to move him out of here? I wasn't sure I felt that he was getting the best care possible. All of those things that you said in that very first slide that you didn't want me thinking as a family member, I was thinking. And then within 2 days, I had the complete opposite experience. So when I told this story at the conference, people had said, well, did you share this information with the hospital? And I said, oh, no, I didn't. I feel uncomfortable. And they said, as a leader in the patient experience movement, how do you not share that story? It can be impactful. So I thought about that, and I thought, okay, so what do I do here? I called the hospital. And I said, you know what? We have to be willing to put ourselves out there, to both listen and then to be heard, to use stories, to create and inspire change. I called the patient experience office at that hospital and asked to talk to the chief experience officer. And I told her I have a story to tell you. And she listened. And it was an amazing experience for me. I did it over the phone. It took me 30 minutes. And I actually love this. I found this from the Health Foundation in the UK, and I think by using stories, such as the one that I just shared personally with you, by using real stories as you communicate your improvement work, you can do a lot. Because I gave this Chief Experience Officer an opportunity to really think about how she could take this story and this information that I had given her and utilize it to improve patient experience across the continuum. So I love this because it talks about, is there a demonstrated need for the work and challenge complacency? Is there a way to make potential benefits or outcomes feel tangible to people that you need to influence? If you need to be heard in order to make an impact or challenge something, utilizing stories and the voices of our patients and our families is so important. And good stories can be remembered and passed on. And I will say that telling a good story is a skill. It is not a skill that everybody has, but it is one that people can learn. And I do like this quite a bit, that if you listen to how I told that story, I didn't tell you a lot of details. I took a total of 4 minutes. It involved only a few people, 3 to 4 people. I hopefully engaged your emotions, which is kind of difficult to do over a webinar, but hopefully did. In a curiosity that makes you think that you want to know more, so tell me more. Tell me more about this story. Paint a picture in words, because you all sort of see that hospital room. I know you can't see what I look like, but could you see that experience and the importance of what that one woman did for us in that hour that she was there? And then leave some form of resolution or barriers, what could be overcome. What I loved about this particular experience of putting myself out there and trying to create change was that she came back to me the next day and she said, Lori, I just want you to know that I called my CEO after we were done talking. The program you were discussing was currently up for the chopping block. We were about to unfund it. And your story has caused us to go back and look at our budget and see if it's a program that we can keep so that families can walk away from our institution after somebody has been in hospice and passed away and had that type of experience that you had. So your story was central for us to relook at this and see if this is something that we can, in fact, keep. For me, it made telling my story worth it. I think so often we ask people to tell their stories, but they never know what the impact is. And so to know that there was an impact, a very substantial impact from sort of being emotionally vulnerable was so important. And the fact that she went to tell my story as an administrator, that wasn't hers, but mine, I think these are a couple of good sort of notes for you to follow. One is that a story conveys a message. Deliver a story that is key to the impact you want to have. So for her, she was fighting to keep this program. At that very same time, I called, told her this experience, and she was able to utilize that. And so, again, you'll have this as you, once the webinar is over, but I just think these are a couple important points as we're telling somebody else's story. Now, the other piece of this is about taking feedback. I'm sure it was not easy for her to listen to my feedback, but it's always important to hear feedback, right? Feedback is the food of champions. And a couple of times during that story, she stopped me and asked for specific details. And at the end of our conversation, what I loved was she said, "What can I do for you right now? What can I do to let you know that you've been heard and that we will address your concerns?" And the fact that she was honest and also actionable in terms of what she was doing was so important. And as we are communicating and getting feedback, we want to know that it can come in so many different forms, right? And so whenever somebody says, "I'd like to provide you with some feedback," I immediately think, oh God, it's going to be negative. But really, it can have so many different forms of communication. And we need to look at all of them. When you are walking through the units or you're doing your leader rounds, we need to observe many different things. One is that we are watching the communication, the action. We are soliciting both positive and negative feedback, and that we're doing it in a variety of forms. That it's not just the survey we're sending out to staff or the surveys that we're sending out to patients and families, but that we're actually calling them and asking them. We're stopping in their room and we're getting feedback. That we're listening to the silence, that we're allowing for that silence to also give us an opportunity to step in and ask for feedback. So in terms of communication, I think it's just important that communication comes in many different forms, verbal, paraverbal, and nonverbal. And to just know that people are going to do this in very different ways, but that your body language and the body language of the person who's providing you that feedback is important, is as important as what they're saying. It plays an extremely important part in sending an effective message. One study found that 93% of a message is conveyed through body language and tone of voice. And that's so important, right? That's so important that as you're listening to people who are sharing their story and you are actively listening, that your body language conveys that you're actually there. You know, for me, I've told many, many stories, but in this particular case, I was telling the story over the phone. And I have to say, if I had heard her typing I would have been furious. And I think, you know, one of the things that we can do is to really make sure that when somebody's trying to tell us something, that we are open to hearing it. And if that moment is not the right moment, stopping the conversation and saying, you know, I need to hear this. I want to hear this. And let's make the exact time where you have my undivided attention and I can fully hear what you're saying. I love this study. This is a study that was done in terms of the perceptions of sitting versus standing as we are talking and communicating with patients and families. Communication, as I said, is not just what we say, but it's how we say it. So this was an interesting study that investigated the impact when a physician was sitting with a family versus standing when speaking with patients and families. And he was a neurosurgeon who was randomly assigned to sit or stand when entering a patient room for a post-op visit following elective spinal surgery. When the physician was seated, the patients and families had a perception that he had spent more time with them. I'm going to say that again. When the physician was seated, patients and families had the perception that more time was spent with them. In addition, the study found that sitting also had a significant impact on patient satisfaction, patient compliance, and provider-patient rapport, all of which are known factors in decreased litigation, decreased length of stays, decreased costs, and improved clinical outcomes. And so you can see here that it was a 14-month study. You can go ahead and look it up. You'll have the citation right here. But you can actually see that even though the perception was that they spent more time, that he actually spent less time when he was sitting. Amazing, right? So something as simple as just going into a room and sitting with a family as a provider, as an administrator, creates a feeling of you are there to listen, you are there to hear, you want to understand their concerns, you want to hear what went well, and that you're really there for them, which is what you all said was one of your goals when we started this webinar. So I kind of just love this as well. In terms of, for me, I'm always thinking about the tangible. What are strategies for effective communications? What's the best way that we're engaging families and talking with them? How can we create an environment on an everyday basis for questions? And so giving patients permission to ask questions is a great opportunity. You can see here there's an example. A physician, as we are talking, you may think of questions. Or you may have concerns that you'd like to talk about. Please feel free to ask me anything that concerns you. Use open-ended statements. His surgeon never listens to me when I have concerns about his care. And imagine what this would be like when the nurse says, what are your concerns? Would you like me to share those with them? The third person approach is an important one that I've seen work really, really well, especially when we have families who maybe aren't communicating in the best way, and you're trying to sort of pull something out of them to help them communicate better with you as a provider. Some parents are concerned that their child will be scared in the operating room after you have left. What are your concerns? Is that one of them? If not, do you have any other ones that we could sit down and address and talk about? As a mom who's had a child with multiple surgeries, you never know when you walk into that room. You feel completely overwhelmed as soon as the surgeon walks in. And even though I may have known all the questions, somehow when they walk in, they fly right out of your head and you don't know what to say. And so if you sort of preempt and say, here are some common concerns that families may have, I'm here to answer those and to talk with you about them. Here's another one that a social worker had said, we've had families with a similar situation. What would you like to hear about how we have supported others through this journey? So, as we come to a close for this webinar, and I'm happy to take any questions, I'm going to bring us back to sort of that expanded perspective on patient experience and to this particular slide, where we're always looking about how the experience encompasses all of the different aspects of the quality improvement that we're trying to do, both with outcomes, service, safety, cost. And that as we're looking at engagement opportunities, as we're looking for feedback from staff and for families, that is central and key and should be part of every quality improvement initiative we're doing, is that we are engaging on both areas, because when you have staff engaged and families engaged, you will have a better outcome. One of the things that I think is important as I was creating this is that we are not just asking the same families to give us feedback, that we are asking in multiple ways, and that the people who aren't giving feedback and that aren't being heard are the ones that we really need to seek out and ask that information. And I think in pediatrics it's incredibly important as well that we give children an opportunity to be heard, that we're asking them and eliciting from them their concerns and their questions. And I think, you know, one of the things that really came true to me was as I mentioned, I had a child who was born with a birth defect, and he's had many, many surgeries. And we were recently, he was about 13, and we were going to his surgeon for a surgical update. And the surgeon and I were talking, and we were talking about, you know, sort of his last sort of craniofacial surgeon, and, you know, what was the next plan and how we need to do all of this. And, you know, he only had 15 minutes with us, so we were kind of rushing through everything. And when we got in the car at 13 years old, you know, I had always made all of the decisions around his plan of care along with his physicians and his team. And, you know, my 13-year-old looked at me and he was completely despondent. And I said, you know, Ethan, what's the matter? Is everything okay? And he said, Mom, nobody asked me what I thought. And I said, okay. He said, they only just asked me, what do I do? Do I play baseball? You know, how's school going? But they didn't ask me what I thought about having another surgery, because I have a very definite opinion. And I felt, wow, nobody stopped in that room, not me as his advocate, not the provider, not the nurse, and said, Ethan, what would you like to be the next step? Because he's the one who has to endure it. And that was a very important, and actually it guided our decision, because for him, he was not ready. And because it was not an essential surgery in that minute, we decided to hold off because of his voice and his value of his opinion and what he wanted for himself. And so asking children, asking significant others, asking the person in the room who's maybe not talking but has a role as a patient and family advocate is so important, because everybody's experience and perception is different, and we want to make sure we're engaging across the board. So I'm going to stop now and see, Kathy, if there's any questions. I think we're right at 12:52. So,
Lori, thank you so much. This was really, really great and engaging information about the patient experience for families in our care. We would love to entertain any questions. The chat box is over on the left. If you will type your question in there, we'll do the best that we can to answer as many as we can in the time that we have left. I think there was one that already came in. How do you reinforce what has been discussed? Do you record or offer written information following a meeting with patients or parents?
Okay, so absolutely. I think that that feedback is so important, that you go back to the provider of the information and let them know what you've done with that information. So in a lot of cases, one of the things that we've been doing is doing voice of the patient panels. And those panels are around quality improvement initiatives. They might not be a family advisory council or a patient family navigator, but really, if you have one specific area that you're trying to improve the quality of care or to get feedback or understand why your scores are low in one particular area, is to have families come in and to do a panel discussion, maybe not for everybody, but a very focused panel discussion in one particular priority area. And what I love about these Voice of the Patient panels that I've been running and working to develop across the country is that they're focused around one particular, that you have an outcome that you'd like to address and you want their feedback on that particular outcome. Let's just say, you know, that you'd been getting scores about in your unit that it was dirty or that, you know, environmentally not clean enough. Bringing in a panel of families to give what that perception was or why it was in a certain way is really, really important. But what I always say is when you're running a panel, you're getting feedback. Responding to that feedback and letting people know what you've done with it or what you've done about it is so key. We want people to come back to our institution, right? We want them to come back and say, you know what, I got the best care. Nothing is ever perfect. It didn't go exactly right, but they heard me and they came back and told me what they did about it. So that report back, that service recovery is so important. And I cannot stress that enough, that we should not be asking people to come in and just share their stories, their entire story in entirety. It's very overwhelming, and sometimes we don't know what to pull away from that as people. What we want to do is to really help understand what we can do better in so many different areas. So if you haven't had a voice of the patient or a voice of the parent panel, you really should think about it, especially if you have a variety of quality improvement initiatives going on where you think you would benefit from feedback.
Great. I don't see any other questions in the chat area. Anyone else have anything they want to add over on the left? While we're waiting to see any more, Lori has another opportunity for people to learn more about patient experience. Lori, do you want to talk a little bit about the pre-conference you're doing?
Absolutely. So that's me in the middle. I know y'all couldn't see me, but that's me in the middle. So my name is Lori Gunther, and I am doing a full day pre-conference at the Perinatal Leadership Forum on the Experience is Everything. I'm partnering with two other great certified patient experience professionals, and Megan King is the Director of Patient Experience at Geisinger. We're going to be covering a number of topics around employee engagement. This was kind of a snapshot of what you would see. We'll be talking about sort of service recovery, employee engagement, physician communication, a variety of wonderful topics. I encourage you to go to the SanovaAssociates.com. You can look up the pre-con and just see a little bit more information about what we're covering. But it's a great opportunity to really sit in a round table and discuss challenges together with other leaders about the patient experience and quality improvement.
Super. And that pre-conference can be attended as a standalone, I believe, so you don't have to attend the whole conference if you're interested in coming. And it is outside Phoenix, Arizona, just FYI. There's another question. Does your institution have a position, i.e. manager family-centered care?
So what we have is we call them NICU Family Support Program Coordinators. We have 81 positions that are all over the country, and their role is really around promoting and coordinating services for families in the NICU. The foundation of everything we do is patient and family-centered care. And then my position at the national level is really around the Director of Strategy and Experience. So my role in particular is really dedicated to promotion of patient and family-centered care and patient experience.
And do you know, Lori,
I have a team of managers that work for me that are all working around patient experience initiatives. For example, we're in the process of developing a digital technology that will provide, education classes, that type of thing nationally. So, my entire team is looking at the patient experience and as it applies across the board to all institutions.
Great. Do you know if other hospitals, newborn units, or NICUs that do have a manager of family-centered care?
We do. Most of the time, the manager for example, yes, I do. So Children's Mercy in Kansas has a family-centered care department. They do a really, really great job. They have patient family advocates and navigators or patient family-centered managers. Kind of patient family-centered care and patient experience, usually they sit under the same department within an institution, but absolutely. Sometimes they're just called different things depending on the institution, patient family-centered coordinators, patient family-centered navigators, things like that.
Super. Well, I don't see any more questions, so I wanted to thank you all for attending and to just to say a little bit about one of our DandleLION products. One of the best patient satisfiers, as we all know, in the maternal infant areas of the hospital is parental bonding or parental time with the baby. And DandleLION does offer two great kangaroo care holding devices that are primarily designed to keep the baby safe in mom or dad's arms, so staff doesn't have to worry about the parents drifting off to sleep or any, accidents that might happen when the baby is spending a long period of time with the mom or the dad. Our original kangaroo cuddler is very reasonably priced and is great for post-C-section transport. And our KK2, our second version, is a reusable product. And again, both offer a lot of safety and peace of mind for the parents and the staff. And if you'd like more information and a free sample, you can indicate your interest on the evaluation form. Now, in order to receive your free CE, you will need to fill out the webinar evaluation. So in the chat area, we hopefully have up the evaluation link. At the end of the evaluation form, after you've completed it, you will receive a link to the CE certificate. If you don't have time to fill out the evaluation right now, or your hospital has blocked access, you will receive an email within the next few days with a link to the evaluation, as well as a link to the recording. And if you're viewing as a group, each of you must log on to the evaluation form in order to get the free CE. We have 35 previous webinars now that have been recorded. The last 3 years are still available and active for continuing education credit, so we hope you'll visit the website if you want to see any of our previous webinars. So other than that, Lori, thank you so much. That was really engaging, a great staff and attendee experience. We appreciate your enthusiasm for the topic and your great delivery. And thank you all for attending. And we hope you have a great weekend. And thanks for participating in another fabulous DandleLION webinar.
Thank you, Kathy.
Lori Gunther, do you want to throw your email address over in the chat? There it seems like there may be a couple questions that just popped up. So just thought maybe you might want to do that for people too.
Absolutely. And of course, as I said, I'm always open to feedback. If you have anything else that you feel as though I could certainly cover or do better, I'm happy to have that. My email address is lgunther@marchofdimes.org, and I've just put it into the attendee chat.
Thanks, Lori, so much.
Thank you.